Welcome to Rockin' OTs, an indoor rock climbing activity analysis. Today we will be studying the kinesiology of rock climbing.
Rock climbing is a sport that requires simultaneous physical and mental coordination that tests a climber's strength, endurance, agility, and balance. The goal of rock climbing is to reach the end point of a predefined route, typically to promote self-achievement of a difficult activity. As a rock climber, it is imperative that one must wear the proper clothing and equipment to prevent injuries. This includes a comfortable shirt, athletic undergarments, athletic pants or shorts, socks, and lightweight athletic shoes. To ensure safety, the climber must wear a harness that attaches to the rope on the wall. The rope holds the weight of the climber as he or she goes up and down the wall.
Cognition is one's ability to consciously gather and process information for the purpose of acquiring knowledge and facilitating behavior. Cognition plays a key role in the climber's ability to safely perform the coordinated movements needed to reach the endpoint of the desired route. The climber's cognition must be intact to carry out various functions that are essential to the intricate movements of rock climbing as well as the safety of the climber. These functions include balance, coordination, attention, concentration, spatial awareness, visualization, and planning. The temporal lobe is involved in primary auditory perception, which is directly responsible for balance due to the ear canal's intact equilibrium. The posterior part of the parietal lobe is responsible for attention, focus, and spatial awareness. The occipital lobe is responsible for visualization. The frontal lobe is responsible for initiating and coordinating motor movements, higher cognitive skills, thinking, planning, and organizing. The cerebellum is responsible for balance, movement, and coordination.
The respiratory system is a series of organs responsible for taking in oxygen and expelling carbon dioxide. Oxygen and carbon dioxide are required for the body to sustain itself. Red blood cells carry oxygen from the lungs and supply parts of the body. The red blood cells also transport carbon dioxide to the lungs where exhalation occurs. The respiratory system is composed of various organs and components that lie in the thoracic cavity. The organs include the nose and nasal cavity, pharynx, larynx, trachea, bronchi, lungs, alveolar diaphragm, and heart. While rock climbing, one's breathing technique should remain smooth, controlled, and calm. 3 simple breathing tips to remember while climbing includes breathing before and after each climb, breathe at a controlled pace, and adjust breathing according to increased movements. While rock climbing, one's breathing technique should remain smooth, controlled, and calm. 3 simple breathing tips to remember while climbing includes breathing before and after each climb, breathe at a controlled pace, and adjust breathing according to increased movements.
The cervical spine is an active component involved in the climber's ability to move the neck in various positions needed to safely plan hand and foot placements. While climbing, one must have normal range of motion for flexion, extension, and rotation of the neck. The cervical spine is comprised of 7 vertebrae, which are the C1 through C7. The vertebrae protect the brainstem and spinal cord, support the skull, and allows a wide range of head movement. The cervical plexus is a plexus of the anterior rami that supply innervation to some of the structures within the neck and trunk. It is composed of axons from spinal nerves C1 through C5 and branches into nerves in the posterior neck and head, as well as the phrenic nerve, which connects to the diaphragm at the base of the thoracic cavity. In neck flexion, the climber's cervical spine should fall between a range of 0 to 45 degrees to be within functional limits. The muscles involved in cervical flexion include the sternocleidomastoid, anterior scalene, longus capitis, and longus colli. As the climber strategizes their following foot placement, these muscles are being used while looking downward to properly gauge safe positioning. This action is an example of contrinsic contraction. In extension, normal range of motion lies between 0 to 45 degrees to be within functional limits. The muscles working include the trapezius, elevator scapula, splenius capitis, splenius cervicis, rectus capitis, posterior major and minor, oblique capitis superior, semispinalis capitis, longissimus capitis, longissimus cervicis, iliocostalis cervicis, multifidi, rotorors, intertransversi, and the interspinalis. As the climber reaches new heights, these muscles are used to aid the cervical spine in planning of hand placement. When extending the neck, the climber is elongating the muscles, performing eccentric contraction. The normal range of motion for rotation lies between 0 to 60 degrees. While rotating the head side to side, the climber can properly sequence hand and foot coordination. The muscles used in cervical rotation include the levator scapula, splenius capitis, splenius cervicis, rectus capitis, posterior major, oblique capitis inferior, longus colli, longus capitis, longissimus capitis, longissimus cervicis, and iliocostalis cervicis. All of these muscles stimulate eccentric contraction.
The shoulder is the most mobile joint in our body. To avoid uneven tension around the shoulder joint, balance muscles are essential for climbing. The muscles of the arm consist of wrist and elbow flexors and extensors. Within these muscles are nerves that innervate them, which are the musculocutaneous, axillary, median, ulnar, and radial nerves, all of which make up the brachial plexus. The brachial plexus is a network of nerves formed by the ventral rami of the lower 4 cervical nerves and first thoracic nerve. Its function is to send signals from the spinal cord to the shoulder, arm, wrist, and hand. The brachial plexus is responsible for each functional movement in the arm that the climber would need to place the arm in the next desired position. The rotator cuff consists of 4 muscles. These muscles include the supraspinatus, infraspinatus, teres minor, and subscapularis. The supraspinatus holds the humerus in place and keeps the climber's upper arm stable. The supraspinatus also aids in raising or extending the arms. The infraspinatus is the main muscle that allows the shoulder to rotate and extend. Teres minor is the smallest muscle of the rotator cuff muscles, and its primary function is to assist with rotation of the arm away from the body. The subscapularis stabilizes the head of the humerus and aids in rotation of the arm, holding the arm out straight and lowering the arm. The rotator cuff muscle's overall function in climbing is to assist in reaching and stabilization.
During the climb, the participant must have normal function of the wrist, hands, and digits, which include flexion, extension, radial, and ulnar deviation. The muscles that extend the wrist include the extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris, extensor digitorum, and extensor indicis. These muscles assist the hand to navigate through the course of the climb. The muscles that flex the phalanges are the flexor digitorum superficialis, flexor digitorum profundus, flexor digiti minimi brevis, lumbricals, dorsal, and palmar interossei. These muscles assist in the fine motor skills needed to grasp the rocks. To release the grasp on the rocks, the extensor digitorum, lumbricals, dorsal interossei, palmar interossei, and extensor indicis work simultaneously to extend the phalanges. For accurate hand positioning, radial and ulnar deviation facilitates in grip strength. The extensor carpi radialis longus, extensor carpi radialis brevis, extensor pollicis longus, extensor pollicis brevis, flexor carpi radialis, and abductor pollicis longus are the muscles associated with radial deviation. and the extensor and flexor carpi ulnaris are the muscles used in ulnar deviation.
The hip is a major component that is needed to successfully and safely reach the end goal of this activity. The hip is a ball and socket synovial joint, the ball being the femoral head and the socket the acetabulum. The pelvis is the foundation of stabilization. It helps the body maintain a normal lumbar curve. The hip joint is the articulation of the pelvis with the femur. The three bones that make up the pelvis include the ilium at the rear, the ischium at the lower front, and the pubis above it. While rock climbing, the climber uses hip flexion to assist the body to move along the wall. The normal range of motion of flexion of the hip is 0 to 120. For the climber to complete this motion, the climber must utilize the psoas major, the iliacus, the tensor fasciae lati, the sartorius, the rectus femoris, the gluteus medius, the gluteus minimus, the adductor longus, pectinis, adductor brevis, and the adductor magnus. External rotation of the hip is used to make alternating movements of the lower extremities, while the climber bears weight on the leg that is fixed on the rock. The muscles used in external rotation of the hip include the gluteus maximus, the piriformis, the quadratus femoris, the abductor internus, the abductor externus, the gemellus superior, the gemellus inferior, the gluteus medius, psoas major, the iliacs, the sartorius, and the biceps femoris. Each of these muscles perform an important function. Specifically, the gluteus maximus muscle located in the buttocks is regarded as one of the strongest muscles in the human body. It is connected to the coccyx or tailbone as well as other surrounding bones. The gluteus maximus muscle is mainly responsible for movement of the hip and thigh. When moving from one rock to another, the knee is extended and the ankle is plantar flexed as the climber pushes downward on the rock to scale along the wall. The knee is flexed and the ankle is dorsiflexed each time the climber steps onto a new rock in effort to reach the new altitudes along the path. Occupational therapists can use rock climbing walls to improve fine and gross motor skills. While rock climbing, the climber must coordinate their hand and legs together. While rock climbing, we are planning how to use muscles to move, while also adjusting the muscles in the legs, core, and arms. There are many benefits to rock climbing. You will receive a full body workout. It would improve your cardio, and it strengthens and tones your muscles. It can increase strength, flexibility, and endurance. And it can also increase problem solving, planning, and decision making abilities.
Thank you for watching Rockin' OTs, an indoor rock climbing activity analysis. See you next time.